Vaginitis is described medically as irritation and/or inflammation of the vagina. Vaginitis is a very common disease affecting millions of women each year. The three most common vaginal infections are bacterial vaginosis BV, Candida vaginitis yeast infection and trichomonas vaginitis trick. What are the signs or symptoms of vaginitis? Vaginal infections can produce a variety of symptoms, such as abnormal or increased discharge, itching, fishy odor, irritation, painful urination or vaginal bleeding. When you have vaginitis, you may have some or all of these symptoms. If you have any of these symptoms, discuss them with your doctor or nurse so that you can be tested. What causes vaginitis and how common is it? Vaginitis has various causes. It may result from bacterial infections, fungal infection, protozoan infection, contact dermatitis or even an allergic reaction. Vaginitis affects millions of women and is one of the primary reasons women visit their doctor. Trichomonas is sexually transmitted, but other vaginitis infections are not usually sexually transmitted. What is the difference between the three types of vaginitis? Bacterial. This type of infection is caused when healthy vaginal organisms are replaced by bacteria. It is referred to as bacterial vaginosis and is the most common type of vaginitis. Yeast. This type of infection is called candidiasis. It is caused by a fungus and is the second most common type of vaginitis. Protozoan. This type of infection is called trichomoniasis and it is considered a sexually transmitted disease (STD). It is the least common and comprises 3% to 5% of all vaginitis infections. What causes bacterial vaginosis? Bacterial vaginosis BV is the name of a condition in women where the normal balance of bacteria in the vagina is disrupted and replaced by an overgrowth of certain bacteria. It is sometimes accompanied by discharge, odor, pain, itching or burning. One type of a good bacteria, Lactobacillus, is particularly important. Lactobacillus keeps the vagina slightly acidic to reduce the growth of potentially harmful organisms. When lactobacilli are replaced with different kinds of a bad bacteria called anaerobic bacteria, an unpleasant vaginal odor develops and an infection vaginitis occurs. Are there any complications associated with vaginitis? Yes, there may be, especially from bacterial vaginosis. If left untreated, BV may result in increased risk of pelvic inflammatory disease PID, infertility, preterm birth, premature rupture of membranes, low birth weight, intra-amniotic infections, endometritis, cervical intraepithelial neoplasia SIN, post-gynecological surgery infections, and increased risk of sexually transmitted diseases. Will my pap smear diagnose a vaginal infection? Although your annual pap smear is a very important test, it is not typically used as a test for vaginitis. How can my doctor tell if I have an infection? The tests for vaginitis are simple and can be done right in your doctor's office. Your doctor will examine your vagina and use a swab to get a sample of the discharge. Vaginitis is identified by checking vaginal fluid appearance, vaginal pH, the presence of volatile amines, the odor-causing gas, and the microscopic detection of clue cells. New tests are now available to aid the physician in his or her diagnosis. How do I address the subject with my healthcare provider? First, do not be embarrassed. Vaginal infections occur in millions of women of all ages and backgrounds. Regular checkups and open discussions regarding your symptoms will go a long way toward maintaining good vaginal health. Your healthcare provider can perform simple tests to determine the type of vaginal infection and provide you with the best treatment. How is vaginitis treated? There are several ways to treat vaginitis, depending upon the cause of the infection. Bacterial vaginosis can be treated orally or intravaginally with a prescription for medication. A yeast infection can be treated orally or intravaginally with either prescription or over-the-counter antifungal medications, and a trichomonas infection is usually treated with a prescribed oral antibiotic. What can I do to prevent initial infections or recurrences? In order to minimize the risk of developing vaginitis, here are some general suggestions for good vaginal health. Practice good hygiene by keeping the vaginal area clean using a mild soap and dry area well. Avoid douching and irritating agents such as harsh soaps and feminine hygiene sprays. Douches can disrupt the normal balance of vaginal organisms and should be avoided. Avoid spreading bacteria from the rectum to the vagina by wiping front to back after going to the bathroom. Avoid tight jeans, pantyhose without a cotton crotch, and other clothing that can trap moisture. Practice abstinence or safe sex and avoid multiple partners. Latex condoms, when used consistently and correctly, can reduce the risk of transmission of STDs. Studies have shown that stress can be a contributing factor. Can vaginitis affect my baby? Yes, it can. Premature delivery and low birth weight of the baby are more common in women with bacterial vaginosis. Early diagnosis and treatment is important. Does my partner need to be tested? Ask your healthcare provider. Some types of vaginitis can be transmitted from one person to another during sexual intercourse. It depends upon what type of vaginitis you have. Can I also be infected with something else? Yes. You can be infected with a sexually transmitted disease and also have vaginitis. Each infection needs to be treated with different medications, so it is important to visit your doctor to determine if you have more than one type of infection. For answers to other questions, please speak with your doctor or nurse.